Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, my name is Mark Houston, and welcome to another edition of Doc Talk with Monument Health. This is kind of the second part of a series that we started with Dr. Luis Hernandez here at Monument Health in Rapid City. He specializes in general cardiology. He's got the interest in heart failure, belongs to the American Medical Association, the American College of Physicians, the American College of Cardiology, the Heart Failure Society of America, too. A long list that means that this guy knows exactly what he's doing, and you're the one we want to see, right, Doctor?
Hi, Mike. Thank you for that big introduction.
Yes.
I think it's a lot when you start saying all those things.
I love it.
I think you should make it short for next time.
Maybe we will. We'll shorten it up a little bit, and I'll just say he's the guy to see. We kind of got the introduction to heart failure in the last episode here.
Yes.
And one thing we didn't, I don't think, quite touched upon it enough before we get into this topic today is once people are diagnosed with heart failure, their obvious question is, well, how do I deal with this? What are the next steps? What am I going to do?
Exactly. And I think that's a very good question. I always tell my patients our goal, at least my goal as a heart failure doctor, is to, make sure they have a normal life. Okay. And that should be my goal. My goal is a lot of people with heart failure are older, older pals, and then you will ask them, so how are you feeling? And they will say, I feel tired. I feel fatigue. But I think it's because I'm getting older. It's not that. I mean, just because you're old doesn't mean you have to feel that way. So a lot of things has to be related with heart failure, and I think that's where this question is important. Again, with the right treatment, patients can have a normal life. In average, they should have a normal life. What about the treatment? I mean, most of them is medical treatment. Most of them is pills. Which is important to remember is if your heart is weak, you need a lot of pills, and all of them work together. And that's important to understand. So taking your pills every day, working with your primary care physician. If you come to Monument, we have our own heart failure dedicated clinic. We do a lot of we have everything you want there. We have genetic testing. Especially you asked me last time about young people with familial cardiomyopathies. So medication is number one thing. We always educate them. That's one of the things I love from Monument is that I have plenty of time to talk to my patients, and I have a dedicated time for education. So I actually spend at least 15 minutes on my visit just educating them about heart failure. We have a book that we had made so they can have all the important information. And one of them is the medications. So it is important that they take their medications every time. It is important that there has to be a communication with the physician. Because a lot of times medication has side effects, and people think that, oh my God, I'm taking this medicine and this is how I have to, I feel bad and I have to feel this the rest of my life. And that's where people is wrong. I always tell my patients, if there's something wrong, I need to know because I need to work around it. I need to find a way. We have guidelines to follow. But my job is to make sure they have a normal life, right?
Right.
So if you're feeling bad, if you're feeling dizzy all the time because of your medicine, if you're feeling something wrong, I need to know so we can fix it, and we try to work around it. So I think medication compliance is very important, having an amazing communication. I believe in knowing. If you know about your disease and you understand about it, I think it will be easier to kind of bear with it. I always say try to involve your family members. A lot of these patients will, imagine your heart is weak, you feel tired all the time. A lot of people is independent, and then when they have heart failure, they have this new diagnosis, they start getting into depression. Why? Because they feel like, I'm going to need someone. My heart is very weak. What I'm going to do, and that's what I tell people, not necessarily. You probably will be okay. And that's why you need to, see a cardiologist, see someone from the heart failure clinic. So we can help you to go with that, to cope with that, see how we can help. So involving your family members is very important for me. I love when my patients come with someone, at least one of the family members, because I have the opportunity to educate both of them. Educate the family, educate the patient. And I always try to make that connection and then explain, part of my job, at least, I always say I feel pride about that at Monument Health. And that's what I love it, because you have that time to talk to them. I ask them, like, tell me where you're from. For me, even understanding what do you do is important, because I had a patient who, when I first met him, he works during the night and sleeps during the day. Imagine how do you tell people when you normally tell them take your medicine 3 times a day or 2 times a day? It's hard, right? So for us, those tiny details are important. So it's important to let your doctor know anything. There's questions that you can't believe they're stupid or they're simple.
Right.
My mom taught me that there's no stupid questions. So I believe that if you have any questions, just ask. It's something very simple. People ask me about activity. Because
that was going to be my next question is exercising then once you get a diagnosis like that?
Yeah. So that's another thing, because people think, oh, I have heart failure. I cannot do anything. I shouldn't be moving. That's wrong. One of the things I told my patients, even if you have heart failure, activity is very important. I really need to know. That you move. It's not moving doesn't count moving inside the house. Okay, let's make that clear.
Right.
Moving inside the house doesn't count like moving. Moving is outside. Go and walk your dog.
I was going to say
a dog.
Something as simple as a walk or
Exactly.
anything like that could pay huge benefits.
Exactly. I don't want you to run a marathon.
Right.
I mean, if you can, why not? I always say that. If you can, why not?
That's interesting. Could somebody, with heart failure and taking the proper medication, could they do something that strenuous?
You should have a normal life if you can. That's the idea of getting you treated.
Sure.
And I always tell my patients, common sense. What do I mean by
Right.
common sense? Let's say that you want to walk 2 miles, right? And then when they're at the half of the mile, they feel out of breath for a second. So take a break, rest for a couple of minutes, get back to your normal, and then head again. You can lower your pace. My post, there's always a way for you to do exercise. You don't have to stop. You need to have your normal life. I have a lot of grandmas, that they want to follow their grandkids,
Right.
And I said, they asked me, can I run behind it? Yeah, why not? If you can, obviously common sense, right?
Yeah. That's okay. Those are the steps that, you should take once a diagnosis is made. And again, I like the fact that you do focus so much on communication because like we talked in the last episode, you hear the word heart failure and you're like, that's it. It's done. My life is over. But having that open communication to make people feel like we're going to take care of this. We're going to get through this.
I always tell them you're not alone.
Yes, and I think that's what a lot of people need to hear. Of course, a lot of people know we've all been through the last 2.5, 3 years of a global pandemic, right? And it's been stressful in a lot of different ways on people's hearts, I think. And what we wanted to talk a little bit about for the rest of this podcast is COVID and heart failure, because I think that in certain situations people think, well, it's the flu. I feel this, I feel a little stuffed up. I'm a little tired. But let's start with if you already have heart failure, COVID was certainly not welcome, right?
Exactly. Yes, it was one of the things that we at least knew. People who had cardiovascular disease or any kind of heart disease. People who have high blood pressure, obesity. Those patients were the high risk group, right? It's still the high risk group. And saying that, patients who had heart failure, they're a very special group. Okay, because just by having heart failure and getting hospitalized, your risk of death is higher than a normal population. I think this is important to differentiate them, because we need to know that people who has heart failure already, who had already a diagnosis, if they get COVID or they contract COVID, the risk of mortality is even higher. Because again, you already have, it can be a weak heart, okay? Or it can be a normal heart, just stiff. And then now you get COVID. Sometimes it's even hard to differentiate COVID versus heart failure. There's some tricks that you can do because both of them will give you out of breath, right?
Right.
Both of them, a lot of people cannot lay flat because they really are, starving from air, gasping from air. So, how, you probably have heard how scary it is just to know about COVID. So the difference is probably COVID doesn't have leg swelling, but heart failure does have leg swelling, right? Another one of the differences, for example, the cardio biomarkers that we use for heart failure, they can be positive in both in COVID. So sometimes for us, that's how hard it is. So it's about clinical decision. It's about, your physical, your history, and kind of deciding what is the right diagnosis. So it's kind of hard. And again, just by having heart failure, mortality is higher when you compare with people with no COVID.
Sure. So if you catch COVID, then if you're a normal, generally healthy person and you end up with it, can that lead to a type of heart failure?
Yes. And yes, that's one of the most complicated parts that we have. As I mentioned, the diagnosis is kind of similar. there are some things that, how do we differentiate them? And again, the swelling, the shortness of breath can be the same. The biomarkers can be the same on both. But for example, fever. Heart failure doesn't cause fever. So again, it's important for us to kind of know what it is. What if you had never had heart failure? This is the question. And the question is, will you develop heart failure? Yes. The answer is there is a chance. Everyone is different, though. Fortunately, there's not a lot of people. But we have two types of people who can develop heart failure. We have a group called myocarditis, which is an inflammation of the actual virus in the heart muscle. And that can make the heart weaker. Okay, so the virus goes into the heart muscle and make it weaker. But this is temporal. So most of the time, we'll recover with a couple of weeks. We do have something else called viral cardiomyopathy, which is the muscle gets, again, the virus again, but this affects the heart probably forever. And there's a lot of people who develop heart failure, they're in the 20s, and they have what we call a viral cardiomyopathy, and the heart will be probably 20s for the rest of their life. And then probably they will require a transplant in the, very long future.
Oh, boy. Now, with the type of disease that COVID is, it's a virus, right? It can be similar to, I don't want to compare it to a flu virus, but it's another virus type. Now, can something like the flu do that to your heart as well?
Same.
Really?
Same. The difference is COVID mechanisms are a little bit different from the flu, but they're the same. So we do have this group called viral myocarditis or viral cardiomyopathy. So all the virus itself can cause this. The difference is the mechanism from COVID is different from all of them.
Okay.
So COVID is very special in all the senses.
Right.
Why COVID is special? For example, COVID can increase your risk of clots. So you can actually have a clot in the lung and affect the heart. Not necessarily means that the heart is having a problem. It's you had another organ affecting close to the lungs. Lungs and heart work together, right? You can have clots in your main vessels of the heart. So you can really have like a heart attack, caused by just increasing the clots from COVID, which typically flu doesn't do that. Like the normal flu doesn't do that. Okay. Affection in the virus is almost similar. But we know now that COVID actually can cause the muscle of the heart to die, the cell to die.
Really?
So it can make the heart fibrotic or make the heart harder. So we know now that the flu doesn't do that. Again, it can. Everything can, right? But the COVID is very special. COVID can affect other organs, at the same time that is affecting the heart. So COVID it's kind of, a very special thing. I hope it can go quick.
Yeah.
I don't think it's going anywhere, though.
No, I agree. I think, that has to be just such a challenge. When something like COVID pops up, how do you find that connection? I mean, where does that come from? I don't think I'm asking the question as well as I'd like to, but a pandemic with a virus pops up, and you're the heart doctor. How does that work?
So in theory, we don't see them directly. There's always been seen by other physicians. When do we get called, for example? I guess that's the question.
Yeah, there you go.
Typically, again, I told you COVID can cause a lot of things positive that are positive in the heart. So when you have direct viral, direct viral invasion, I guess, to the muscle, the heart will suffer and it will leak something called troponin, which is an enzyme that we look for when you have a heart attack. Okay. So sometimes we will get called because they say, the troponins are positive, and obviously, again, depends on the clinical scenario. Probably it's just the direct invasion instead of a heart attack. Or we will get an ultrasound. Most of the time when that happens, they will get an ultrasound of the heart. We talk about how diagnosing heart failure before. And that ultrasound will show that the heart is weak. And then when we see that the heart is weak, that's how we get called, and that's how we get involved in the middle.
Got it.
Yeah.
Okay. I know you touched a little bit earlier. You mentioned the word pumps, and I know we had been talking a little bit before the podcast started. I was curious to whether or not transplants were available. That must be a very you must have to have a pretty special facility in order for transplants. They're not just at every hospital in every town. Obviously, you got places you got to go. But you were talking about pumps and the ability, or that ability coming soon, to Rapid City. And that's got to be a pretty big deal, isn't it?
I know. It's, we're still planning on it. We're kind of planning for 2024.
Okay.
We want to give the patient the opportunity to get better treated. I believe that we are in a very strategic region in the sense that all my patients come from everywhere, far away.
Well, you get so many small town people that, maybe don't have the ability to get to Denver, to Minneapolis.
Exactly. And that's my point. The closest basically will be Denver.
Sure.
Which is almost 6 hours and a half driving.
Yep.
Then the other one will be Mayo, which is like 10 to 12 hours. And then the other one will be Omaha, which is another 10 to 12 hours driving. So, and there's nothing in the north. So, so we're planning to see if we can be the first, hospital in South Dakota, because not even Sioux Falls doesn't have it.
That would be
so
amazing.
So I think will be a new thing.
And rumor has it you might be the guy to be leading this, correct?
Yes, yes.
That would be fantastic.
Yes. God allows, Let's see. Yes.
This, again, has been another really interesting conversation with you, Dr. Hernandez. And I know we want to have one more sit down with you. I think the diabetes is probably it's one of the biggest factors, isn't it?
Yep.
As far as heart failure goes, and I know, unfortunately, it affects a lot of people around here.
Yeah, it's a very common disease.
Yes. So I think next time we talk, Doctor, let's talk a little bit about that and how we can make people feel comfortable here in Rapid City with you at the helm, and that it can be taken care of. All right, let's do that here next time.
See you next time.
Yes, thank you so much. It's Dr. Hernandez. This is Doc Talk with Monument Health.